In fact, trans fats are so ugly and so disgusting for our body that the US government Hey guys, Fitness Science coming at you with part 2 of my series on meat, cancer and heart health. And in part 2, which is this video, we're going to be looking at whether fat intake is correlated to heart disease. In part 1, I mentioned the two hypotheses, the first one being the lipid hypothesis and the second one being the heart to diet hypothesis. Now, if we look at the lipid hypothesis firstly, we need to understand that lipids and fats, which are the same thing essentially when we take them in, they hate water. They absolutely fear water and they dissolve very poorly in water, as you would know if you ever put olive oil into water. They hate water and they just do not mix well at all. But the problem is our tissues in our body require fat to operate. One of the most important things that they use fat for is things like hormone metabolism, and they need fat to get into what are usually very watery cellular environments. So the fats in our body need to be carried around by things called lipoproteins, which bridge the gap between the water-hating fat and the water in our cells, which need fat to operate. Our cells need fat to operate. So this is the way to bridge the gap. Lipoproteins. Now, these lipoproteins, which carry the fat around our body, are generally classed into two categories, high density and low density, and that refers to the fat content that they carry in their actual structure. And it's basically the ratio of the lipoprotein itself to the lipid content which they carry. So a high density lipoprotein has a lot of protein and carries not much fat, whereas a low density protein, and as we get lower and lower, we can actually get very low density lipoproteins. They carry a lot of fat and have not much protein in the actual backbone. But there's another annoying protein called ApoB, which is apolipoprotein B, that has been found in numerous studies. The link is very, very clear that this little protein, ApoB, is very, very related to heart disease and is the #1 factor in the development of plaque on our artery walls. And the reason is because ApoB provides the structural integrity for the lower density lipoproteins on the other end of the scale. So your low density and your very low density lipoproteins, it's the backbone for those guys. And there are receptors in our cells and tissues for ApoB. And when ApoB binds to those receptors, deposition of fat occurs and plaque builds up. And consistently, the evidence says that the higher amount of fat you're carrying on your lipoprotein, the more likely you are to develop coronary artery disease, especially when those lipoproteins are low in density. And how do we measure exactly how much mass of fat is being carried on our LDL or very low density lipoprotein particles? Well, it's a formula which is our total cholesterol minus our HDL cholesterol, and that's the amount of fat that we're carrying on our lipoproteins, the lower density ones, around our body. And that is the key number that is very dangerous for heart disease, especially plaque development in our coronary arteries. This graph here is based on data from over 200 different studies, over 2 million participants, and over 20 million combined years of follow-up data across all these participants. There was a total of 150,000 cardiovascular events across this time period in these 2 million people, and it shows a clear and consistent relationship that the lower the exposure to LDL, the lower the risk of heart disease. And remember in part 1 when I was talking about experimental studies being the more gold standard rather than observational studies? Well, there have been over 30 experimental studies that have analysed over 200,000 people to date and captured 30,000 heart-related events, so heart attacks, sudden cardiac deaths, arrhythmias, things like that. And these studies have specifically looked at what happens when these people have been told to lower their LDL either through pharmacology like statins or diet or exercise or lifestyle changes. And again, there's a clear and consistent relationship that lowering your LDL severely reduces your risk of heart attack. In fact, for every 1 millimole per litre decrease in LDL concentration, your heart disease risk drops by about 20%. So the evidence between LDL concentrations and heart disease is actually pretty clear. But how do we actually reduce our LDL? Well, that's where the heart to diet hypothesis comes in and where meat may be implicated. Now, the idea is reducing our dietary fats by a direct intervention into our diet. So trying to reduce saturated fats as well as trans fats and other bad fats. We can actually reduce our cholesterol levels in our blood, and therefore we're getting that 20% decrease in heart disease risk for every 1 millimole liter of decrease in LDL concentration. And then this feeds nicely back into the lipid hypothesis in that we're then reducing our lipids, which then ultimately reduces the plaque in our arteries. But what fats are the worst, and how does meat play into this? Well, all different types of fats have a different chemical structure, but one of the worst fats is trans fats because its unique kink in its chemical structure is such that it is very, very reactive and inflammatory to our heart and our vessels and our general organs and cells. In fact, every 2% of trans fats increase in the amount of calories you're eating per day. So if you're having like 2, 4, 6, 8, every step up in terms of trans fats like that out of your total calories of the day will increase your risk of heart disease by 23%. In fact, trans fats are so ugly and so disgusting for our body that the US government outlawed them and banned trans fats in 2019. Now, saturated fats, which are part of meat and animal fat, have a chemical structure that's basically a long chain of carbon atoms bonded to hydrogen atoms, but each carbon atom on the chain is fully loaded, so saturated with as many hydrogen atoms as it can take. And these are the fats that we know, like butters, milk, animal fats, coconut oils, full fat yogurt, things like that. Anything that's sort of like from an animal product or something like that will usually have a saturated fat component, red meat being one of these key components. Now, red meat does have a lot of saturated fat. In part 3, we're going to be taking a specific look at whether the saturated fat in red meat and its consumption is so high that it should be a concern for heart disease, given what we know about saturated fats and plaque development. Thank you so much for watching, guys. Stay tuned for part 3, where I'll be discussing specifically meat. Thank you so much for all the support. Really appreciate you, and thank you for watching this video series. I will see you soon.